Hi everyone, I'm Suzy Cohen. I hosted the Thyroid Summit along with Dr. David Brownstein, which broadcast online for free last June 2014. We were live to 170 countries and over 100,000 of you tuned in to learn about thyroid disease, metabolism, weight gain, hormones. We talked about it all. Since the summit, I've received so many questions. So by the end of this presentation, I hope I will have answered all or most of them. And during the next few minutes, you're going to learn about the 6 essential steps to feeling thyroid healthy and a whole lot more. But first, the fine print. Gosh, I just like pesky little details like this, but I have to do it. All right, let's get to it. This is your thyroid system. Your hypothalamus sits inside your brain and produces a hormone called TSH, which stands for thyroid stimulating hormone. Whenever you make TSH, you stimulate your thyroid gland to produce thyroid hormone. Now there's a feedback loop. Basically, the more thyroid hormone your gland makes, the lower your TSH levels will be. And when you have high levels of TSH, that basically says your thyroid gland is just sitting around, it's kind of lazy, it's not functioning well, and it's not producing enough thyroid hormone for you. Most doctors measure the TSH, and they use it to monitor your progress or to help decide the medication dose. I have a big problem with that. I'll tell you in a few minutes. But right now, I want you to realize your thyroid gland sits at the base of your neck. You probably know that. And its primary purpose is to keep you feeling alert so you're not tired. And it also burns food and turns it into fuel so you have energy. Now, this schematic shows how your thyroid hormone comes out of your thyroid gland and really works towards managing and regulating your metabolism, your energy, your mood, and your comfort levels. So the gland actually produces thyroxine. Thyroxine is completely inactive. It doesn't really do anything for you. Your body has to first convert that into something else in order for you to wake up and feel sexy and burn fat and lose weight. So this thyroxine that comes out of your thyroid gland, we often refer to it as T4, and it must be converted to T3 in order to work. T3 stands for triiodothyronine. Now you know why we call it T3. Anyway, think of your thyroid gland as a thermostat. When it's working well, it's like your gas pedal. It gives you energy and makes your body go. It produces a hormone that helps you with metabolism so you can turn the fat in calories in your food into fuel and energy. And when you burn fat and calories, that warms you up. That explains why people who have hypothyroidism often feel cold. If your thyroid gland is sluggish, you're going to feel cold all the time. Now, your thyroid hormone will help you with energy. And when your thyroid hormone levels are low, you will have chronic fatigue. Thyroid hormone lifts your mood and reduces anxiety and depression. One of the largest studies ever done showed that T3, thyroid hormone, worked better than certain prescribed antidepressants. And of course, it's not going to have those terrible side effects that some of the antidepressants will have as well. Now, for those of you in pain, I realize there's many reasons for pain, but I don't see any reason why taking thyroid hormone would hurt. So please ask your physician if you can take some thyroid medicine along with your pain pills, because analgesics were shown in a study to work even better in the presence of adequate thyroid hormone. So my schematic is very basic. Keep in mind that as we go along, thyroid hormone is used every second of the day for one metabolic reaction or another. The classic sign of hypothyroidism is losing your hair or thinning of your hair, or a problem with your hair. It could be just dry, brittle hair. You'll want to check your iron levels. I'll tell you in a minute, but right now I just want you to understand that the classic sign for hypothyroidism is hair loss, and it can also be as simple as losing the outer edge of your eyebrows. So you only have like half of an eyebrow, and the outer third is thin or gone. Now, for women, this can be very scary. You'll see your hair falling in the drain, or you'll look at your face and, part of your eyebrows are missing, or your eyelashes have started to fall out. One thing to keep in mind is some drugs, even levothyroxine, very popular drug, can cause hair loss. And it's not the drug itself, it's the fact that your body is causing a conversion of that medication into a hibernation hormone called reverse T3. And I'll teach you about that a little bit later. But the take-home point is that if you're hypothyroid and you're taking levothyroxine and you're losing your hair, you may need a form of thyroid medicine called Cytomel or compounded T3. You could also switch your levothyroxine to natural desiccated thyroid. We will talk about these medications a little bit later. Just want you to know that excessive or prolonged hair loss can be a side effect of certain medications. And again, I mentioned ferritin. This is a storage form of iron. I know ferritin well. I'll tell you my personal story momentarily. But when your iron levels are low, your hair is more apt to fall out easier. Let's talk about more symptoms of hypothyroidism. Depression, brain fog, problems with memory or trying to figure out the right word, dizziness, especially when you've been sitting for a little bit while, anxiety, insomnia, or excessive sleepiness. It could go either way. Weight gain and chronic fatigue are pretty classic. Feeling cold, you're often the coldest person in the room. You can be cold even with gloves on or with socks and shoes. It doesn't matter because your body temperature is low, so you're going to feel cold all the time. If you're suddenly short-tempered and that's aberrant for you, this could be a sign that your thyroid levels have plummeted. Also, bad PMS, muscle cramps or spasms, heart palpitations or skipped beats, problems in the bathroom, probably irritable bowel syndrome, could be constipation, could be alternating, weakness. All of those symptoms can be signs of hypothyroidism. And just basically you don't feel like yourself. You know something's wrong, something's amiss, and the doctor's telling you you're probably okay, but you know that there's something wrong. That's classic hypothyroidism. A lot of you are misdiagnosed. In fact, 60% of people are unaware that they have a thyroid problem, and I think it's because of poor testing, which I'll talk about momentarily. But people with thyroid disease are unaware because they're misdiagnosed with so many other conditions. You can see from the symptom list how easily you could get classified into having fibromyalgia or chronic fatigue syndrome. Women are handed prescriptions for antidepressants for their, quote, depression, unquote, or they're told you're just going through the change. You know, the facts back me up on this. Again, 60% of people with thyroid disease are unaware. So you'll often see people suffering with all kinds of problems, food sensitivities, allergies, and all the symptoms I listed a minute ago. It's just so unfortunate to me that thyroid disease is picked up more frequently. It should be picked up more frequently, and it's not. And oftentimes skin conditions are involved. In fact, if you have psoriasis or eczema, you can almost count on your thyroid gland not working properly, even though your TSH may be totally normal. Take a look at me. On the left, that's me in 2007, and the picture on the right is me in 2013. My TSH was perfectly normal. In fact, I had normal iron and hemoglobin, I had normal hematocrit. Pretty much everything was normal until doctor discovered that my ferritin was very low. It was 8 at the time. And so this was causing me to be hypothyroid, even though my TSH was showing up as normal. I have a 5'3" frame. I'm kind of little, and that's only like maybe 14, 15 pounds. And you can see what a difference that makes when you lose it. So I had to optimize my thyroid hormone levels. I didn't really know that at the time. I had to discover all this by myself because the doctor, he thought I had depression. I don't know how he got that. All I told him is that I get dizzy when I'm doing Zumba and I'm tired all the time. But anyway, he tried to give me a prescription for Zoloft. I said no thank you to that and started my own search. And you're watching the results of that. I know one thing. Cleaning up my diet made a huge difference. I stopped eating dairy and gluten the best I could. I had occasional cheats, but I did the best I could for years. I forced myself to exercise very gently. I was very careful not to spin too fast in Zumba because I would get dizzy. I took supplements to support my cell membrane health. And at some point I moved to a different part of the country here in Colorado where I feel better. I also went off oral contraceptives, which were making me anemic and hypothyroid because they are drug muggers of B vitamins and minerals. So if you're taking oral contraceptives, this is a drug mugger for B vitamins and minerals that you need to make thyroid hormone. So those drugs will ultimately cause you to feel bad. Started drinking pure filtered water, and I did some other things. I stopped eating anything with white refined sugar. I just basically retrained my palate to more bitter and to more generic foods and went off all the sweets. And I switched my salt. Salt is a big deal. The salts with color, like Celtic salt and Himalayan salt and real salt, they have color because they have minerals in them. And your thyroid gland is starving for minerals. So get rid of the nutritionally naked white table salt and switch to some salts with color. It's a big deal. And later on, I'll talk to you about genes. I had the genes that really push you in the direction of thyroid disease, but it doesn't matter because the epigenetics matter more. And so all of those changes that I made really helped me. And it took a little less than 2 years to normalize all my hormones and to feel great again. I've been healthy ever since, and I've been on a mission to help others. So one of the first things I want to talk to you about is the distinction between feeling hypothyroid or thyroid sick. Which are you? The distinction is huge, and understanding the difference may ultimately bring you back to good health. When you're hypothyroid, your gland isn't functioning well. It's not producing enough thyroid hormone. The term hypothyroid applies because you're producing less than optimal levels of thyroid hormone, right? So you are hypothyroid. But what if you produce enough? What if your levels of thyroid hormone are perfectly adequate, but your cells can't convert the thyroid hormone to an active form? You're not clinically hypothyroid, are you? You're what I call thyroid sick. The same applies to your inability to take the hormone into your cells. Poor transport of thyroid hormone can also make a person thyroid sick. So if your thyroid gland is healthy and it's making plenty of thyroid hormone, but that hormone is not used by the cells, I'm going to call you thyroid sick. If you just simply don't make enough thyroid hormone or you've had a thyroidectomy, I would call you hypothyroid in that case. Now, let's get to step 1 of my 6 essential steps to feeling thyroid healthy. Step 1, don't believe your test results. Believe how you feel, because your TSH can be perfectly normal and you may feel terrible because you are truly thyroid sick. And my image here it's a cartoon. It's kind of tongue-in-cheek. I'm trying to be funny here with the doctor saying, great news, your TSH test shows you are normal, right? But you're just feeling face-down fatigue. So understand the normal reference range for the TSH test was established a very long time ago. The reference range was based upon samples of people who were sick. They were hypothyroid. So if your lab comes back and you fall into that, quote, normal reference range, you're probably low in thyroid too, just like the population they use to define those parameters. What I'm saying is you can be very thyroid sick, and you know you can, but your labs could appear normal because the reference range on the TSH and other tests, it's not adequate. Now, if your physician stubbornly adheres to the normal range and says you're normal and you're fine and go home and you're okay and it's just depression or whatever, because your labs fall into that normal range, I suggest you find a doctor that really understands how the reference range came to be, because that's important. Now let's take a look at those labs. This slide shows you my preferred reference range for the TSH, which should be 0.1 to 1.5. I won't argue with you if you fall under that or above it and you tell me you feel great, but as a general rule, that's what you're shooting for. Current standards say now that if you're less than 4.5, then you're probably okay, but I totally disagree. I think you need to be less than 1.5. Now take a look at these other ranges. Don't be terribly fixed on reducing reverse T3 if it is very high. This marker goes up during times of stress or infection. In a way, it's telling you that you need to rest. And it's also telling you your stress levels might be too high. It's really better to look at your reverse T3 over time, like once every 2 months, maybe get an average every 2 months over the course of 8 months total. So then you can see if it's still high, then, maybe you need some help. Many of you want to rush in and take Cytomel or compounded T3 medications in order to reduce an elevated reverse T3. That's kind of like putting fuel into the fire. Remember, T3 drugs are like your gas pedal. And if your body is dealing with stress, evidenced by that high RT3, then you should instead try to reduce your cortisol and stress in your body. That'll make your RT3 go down real fast. And we'll talk about ways to reduce stress shortly. You'll also want to detoxify better. Again, the answer isn't to bring in more fuel, as in more T3, if your body already has a high RT3. Now, I want to touch on the free T3 to reverse T3 ratio. That's probably your best way of determining a snapshot of what's inside your cell, and you want that to be less than 2. Last but not least, the TBG, thyroid bindingglobulin. The higher this is, the lower your thyroid hormone. Eating commercial meats and dairy might cause that to go up. So can plastics, which I'll talk about later in this presentation. Before any thyroid hormone medication will work and address these levels, your adrenals will have to be working correctly. So let's talk about the adrenal connection next. The reason that's so important is because the symptoms of poor adrenal function can often be confused with low thyroid. As a result of chronic stress, many of you with high cortisol levels show signs of low thyroid. The symptoms overlap, and doctors tend to just give you more and more thyroid medicine. They keep raising your dose instead of recognizing your adrenal fatigue and testing you. All you need to do is take a 4-point cortisol test using your saliva. The 4 points refer to 4 points in time: 6 a.m., noon, 6 p.m., and midnight. This is a saliva test. You can ask your doctor about it. Some people affectionately call them spit tests, but it's technically a saliva test, just so you know. But the symptoms of adrenal fatigue are pretty easy to spot. You eat like a bird, but you never lose weight. You have problems with your skin, hair, and nails. You often sneeze or have allergies. You're prone to infections, whether those are respiratory or urinary tract, any kind of infection really. You have chronic fatigue, and it isn't fixed by resting or sleeping. And a classic sign is you come alive around 9 or 10 o'clock at night. Okay, so step 2 then would be to support your adrenal gland function. Everyone with thyroid disease has some degree of adrenal problems. Basically, when your thyroid activity goes down at the beginning of your illness, your adrenals will pick up the slack and produce cortisol hormone for you. So you'll see cortisol spikes. That means your stress levels are high. Cortisol is natural to the body, okay? I don't want you to think cortisol is bad. We need a certain amount of it to cope. But after a while of coping with all the microstressors in our life, the cortisol levels begin to peter out and you eventually flatline. Now, undiagnosed or misdiagnosed thyroid disease will cause even more adrenal function, taxing your adrenals because they have to pick up the slack for everything you're dealing with. The late nights, the bad eating, the stressful job, the stressful relationships, travel, everything. A car accident, childbirth, losing a loved one, divorce, any kind of bad breakup, this can trigger abnormal amounts of stress in your life and therefore can cause adrenal burnout. So while the adrenals are on overdrive, you're overproducing cortisol for a while until you eventually run out. Now, during the time that the cortisol levels are high, it's causing problems. In excess, cortisol is an inflammation and pain chemical. It's technically known as a pro-inflammatory cytokine when it's produced in excess, and it causes belly fat. Yep, cortisol is your belly fat hormone. Big belly, lots of cortisol. What brings cortisol down? Rest and relaxation. There's really no faster way. Again, too much cortisol caused by the adrenal gland's response to chronic stress will cause your tissues to stop responding to thyroid hormone. So your thyroid gland can be making it perfectly fine, but too much cortisol and your cells say, talk to the hand. They don't care how much thyroid hormone's out there. They're not going to let it into the cell. That's going to make you thyroid sick. And this is what I think happens to most people. I don't think most people are hypothyroid. I think their thyroid gland works just fine. I just think that the cells don't get the signal or that hormone doesn't transport well into the cells. So to summarize this particular slide, if you don't balance your adrenal hormones and nourish the adrenal glands first, you won't respond to thyroid medicine. And a common mistake practitioners make is they keep raising your thyroid medicine until you feel better. The dose just goes up and up every few months. But really what they should be doing is pulling back on the medicine, maybe even discontinuing it, and fixing your adrenal glands, and then reinstitute the medication. Take a look at this slide. This is a schematic of how your cortisol levels spike and go up for a while, and then over time, they flatline. Now, this process varies from person to person. It could happen within a matter of months, and it could take years for a person to flatline. That's a very individual thing. But your first clue of adrenal fatigue is that you need coffee to get through the day. I'm not judging you if you're in Starbucks right now, but I'm just pointing out that you're not drinking the coffee because it tastes good. You're drinking it because you can't get by without it. That's a huge, huge clue. And you feel better from it too. Okay, so stressors that can lead to adrenal fatigue, what are they so that you can avoid them? You need to know. Some of the stressors include anger, replaying bad situations in your life over and over, a chronic illness, maybe you had surgery, diets that include a lot of sweets and soda pop, that can cause adrenal fatigue, overdoing your exercise regimen, and sleep deprivation. I've researched other causes, and some people report adrenal problems following a root canal or a foodborne illness like Giardia. Some people have reported adrenal fatigue after having H. pylori infections, which are very common for people with ulcers. Also, people with migraines, they seem to be high with H. pylori. So let's talk about fixing the adrenal glands. One of the best ways are using adaptogens. These are natural plant-based substances that improve the ability for you to overcome stressful conditions. They're adaptogens that basically help you adapt. They work by affecting the endocrine and hormone systems. And they're smart. They know whether to make your hormones go up or down. These herbs help treat various different diseases too. But basically, I'm listing them. The first one is rhodiola because it has a great ability to help you overcome fatigue. It's a Siberian herb used to help reduce fatigue and stabilize the mood. It has an effect on your neurotransmitters too, like dopamine and norepinephrine, and it can help with strength, endurance, and mental acuity. I personally think it's best for people who have high cortisol. It's not so good if you're flatline. The reason is because it's very good at bringing cortisol levels down and blood sugar levels, by the way, too. So you don't want to take rhodiola if you've been stressed out a really, really long time and you're probably flatlined because it could exacerbate things. Rhodiola increases the oxygen carrying capacity of our red blood cells. So I think it's great for people who are short of breath very quickly or people who are anemic. Let's take a look at licorice. I'm talking about the herb, not the candy. Licorice, also known as Glycyrrhiza glabra, it's not only an adaptogen, but it also has some antiviral, anti-inflammatory, and antioxidant powers. It's an immunomodulator. I love licorice, but too much and it will raise your blood pressure, so be real careful with that. Only take this under the advice of your practitioner. In fact, many of my practitioner friends tell me that small, safe dosages of licorice have been dramatically beneficial to their patients with chronic infections. And there's many ways you can get licorice. You can buy it as a tea or an extract or supplements. I just use the bark. I get it at a local apothecary and I make tea. But you can buy commercial extracts that are already prepared and purified in dietary supplement form at any health food store. Let's move on to ashwagandha. It's my favorite. It nourishes the adrenal glands as well as ramping up production of thyroid hormone. So it actually helps with peripheral conversion of thyroid hormone, which I'll talk to you about momentarily. Ashwagandha happens to have an aphrodisiac effect. This herb was shown to support regeneration of nerve cells and synapses. A 2009 randomized controlled clinical trial found that ashwagandha could also treat anxiety, panic attacks, and phobia. How amazing is that? You can see why it's my favorite. And as long as we're talking about adrenal glands, I would be remiss if I didn't even throw out an honorable mention to vitamin C and pantothenic acid. Those are absolute musts. So anyway, using one or more of the adaptogens that I've included here in my slideshow can help you with step 2, supporting adrenal function. Let's move on to step 3 now. Step 3 is to avoid the triggers from now on. This will be your best and cheapest way to avoid thyroid disease. What precipitates a person to thyroid disease? I mean, think about it. Why do you have it but not your neighbor? Why do you have it and not your sister or your best friend? I mean, there's so many factors, including genetics. But the most obvious triggers are the unnatural chemicals that some of us have in our life. And for example, I'm talking about synthetic drugs or fluoride, processed food, plastic chemicals, and of course stress, which we've discussed already today. These triggers can cause classic hypothyroidism, but more often they just make you thyroid sick, meaning you can't activate or transport your thyroid hormone. And by activate, I mean you can't convert your T4 to T3, which I'll explain shortly. Let me just stick to this a little bit longer because fluoride is a very, very big drug mugger of iodine, and it's a big trigger for thyroid disease. And I know you're probably thinking of fluoride in the form of toothpaste or dental products. And yeah, that's included here, but I think we have bigger problems with fluoride and more important ways that we come into contact with it. But the big deal is that fluoride is a drug mugger of iodine. And by drug mugger, I mean that it lowers levels of iodine in the body. And fluoride will compete for the same receptor site on the cell, and so it prevents the iodine from latching on the cell. No iodine around? That means you can't make thyroid hormone. So take a look at the slide. This is an extensive list of drugs that have a fluoride backbone. Antidepressants, statin cholesterol drugs, antifungals, steroids. Look at that, the OCD drug fluvoxamine, midazolam, that was implicated in Michael Jackson's passing. Lansoprazole, fluoroquinolones. Oh my gosh, that's a big, big category. That includes ciprofloxacin, levofloxacin, moxifloxacin, and others. So these drugs have a backbone made of fluoride. And what I'm saying is that that fluoride will compete for the same cell's receptor site, knock iodine off. And when there's no iodine around, you can't make thyroid hormone. So look in your medicine cabinet. Do you take any? And are you experiencing thyroid difficulties? And just FYI, I'm not telling you to stop these drugs. I'm just suggesting that, if you have a thyroid problem and you take these, that you ask your doctor for another drug instead that doesn't have a fluoride backbone. I don't know if you picked up on this, but the statin cholesterol drugs, that's a big, big drug category. Atorvastatin goes by the brand name Lipitor. And again, you may be doing just fine, but if you started taking Lipitor and you've developed thyroid problems, you may need some medicine or you may want to talk to your doctor about what your options are. Okay, so let's look at these plastic water bottles because so many of us are toting these around. They interfere with thyroid hormone. We all know that plastics are bad for us. That's nothing new. We all kind of know they're endocrine disruptors and they affect the levels of our hormones, especially estradiol, a form of estrogen. But most people don't realize that plastics reduce lithium. We need lithium. This is a trace metal that supports a good mood. And we know that lithium is low in people with bipolar disorder who often take a prescription medication. But here's a little known fact you need to know to get well. Lithium is required for the B12 transporter that shuttles vitamin B12 into your cells. If that transporter is down, it means you'll have a B12 deficiency, even if your serum B12 levels are normal, because the B12 is not inside the cell. So you could have a B12 deficiency. This is technically termed pernicious anemia, and you could literally experience brain shrinkage over time and lowered thyroid hormone, of course. Of particular importance, if you have Hashimoto's disease, you should be especially careful to screen for pernicious anemia. So the connection here is that plastics not only introduce fake estrogens, we know that part really well, but they also indirectly reduce thyroid hormone by crashing lithium levels. So you can think of plastic water bottles as crashing your mood too, because you need lithium for a stable mood. If you have any psychiatric or emotional disorders, I'd start drinking filtered water. I use a Berkey filter at home. I would avoid the soft plastic water bottles as much as you can. And you should also ask your practitioner if low doses of lithium, such as those from the health food store, could help you. I'm talking about very low lithium doses, like lithium orotate. It's sold over the counter in little doses. I'm not talking about the medication here. That's a big, huge dose. I'm not recommending that at all. Okay. So let's keep going to this next slide with thyroid binding globulin, because plastics, they're endocrine disruptors. They raise estrogen. What does that mean? Okay, when you have higher levels of estrogen or estradiol, this causes an increase in a protein you make called thyroid binding globulin. It's abbreviated TBG. You want some of this thyroid binding globulin or TBG. It's an important transporter. You need it. It means it transports or shuttles T4 around the blood as if it were a snack bar, just waiting to be dropped off at the cell and unwrapped and eaten. So TBG is a transporter of thyroid hormone. It binds up T4, making it unavailable to your cells. Too much TBG is a problem. Too much TBG means that you have no T4 available to your cells because it's all bound up. When TBG is high, free T4 and free T3 is low, and you'll have all the symptoms of hypothyroidism. Basically, you're thyroid sick. You want your TBG to be normal, not elevated. In summary, I'm saying that plastic water bottles increase estrogen, that increases TBG, and that reduces your thyroid activity. And it's not just plastic water bottles, it's anything that increases levels of estrogens. Let me show you what I mean on the next slide. Oral contraceptives and hormone replacement meds used for menopause raise TBG levels. That's why some of you ladies feel worse taking those pills, or you start to get tired or lose your hair or your eyebrows or get dry skin. All of these symptoms that go with thyroid disease, and it happens shortly after you begin the pill. By shortly after, it could be a month or two, it could be within a year or two. Basically, they could be making you thyroid sick while raising your estrogen levels. They are lowering your levels of thyroid hormone. So some of you could benefit from a little bioidentical progesterone, which balances the estrogen, and thus it reduces levels of TBG, which, by the way, you want those levels to be between 13 and 39 micrograms per mil. Above 40, and you're gonna feel thyroid sick. That concludes the first part of my presentation, and we've covered a ton. Everything from signs and symptoms to the difference between feeling hypothyroid and thyroid sick. That's a big difference, and it can make the difference in you getting well or not. We've covered lab tests and the proper reference ranges, adrenals and cortisol and how stress impacts your life. I've covered adaptogenic herbs and how to avoid triggers, fluoride, fluoroquinolone drugs and the dangers, plastic water bottles, and B12. I hope you've enjoyed this presentation. I want you to look out for the next presentation, because in part 2, we're going to talk about much more. I'm going to teach you about how you can activate your thyroid hormone. T3 activation needs to happen in 1 trillion cells every day. And if it's not happening, you're going to feel very tired. So in part 2, we're going to talk about that. We're going to find out what slows down the conversion of your thyroid hormone. I'll talk to you about levothyroxine. Did you know it's an inactive drug? Yeah, your body has to activate that. And you need zinc and selenium and iron. We're going to talk about that. I'm also going to teach you about reverse T3. I'm going to cover the importance of greens in part 2. Greens are a great detoxifier. Greens can help you with bad breath if you happen to have that. Makes you more kissable. It's a little known fact. But greens are important for your body because you need those minerals in order to convert your inactive thyroid hormone to active thyroid hormone. And in part 2, I'm also going to cover iodine and vitamin D. I'll be covering information about Hashimoto's and what the best medication is for Hashimoto's. I'm going to touch on migraines and drug nutrient depletion, methylation. It's a great presentation. Please stay tuned because we're going to talk about so much more in part 2, and I don't want you to miss it. I want you all to feel better. And in order to start feeling better and having energy and losing weight and living the life you imagine, you need to know these things. That's what I'm here for. I'll see you next time. Take care.